Hello, I'm Bruce Fawcett. I'm a podiatrist and have practiced in the Raleigh, Chapel Hill area for 25 years. I'd like to talk to you about some common foot problems. One of the things we have a lot of questions about and see on a daily basis is a problem simply called a bunion. A lot of foot problems have peculiar funny names, bunions, corns, but a bunion in particular is a swelling up of the first toe joint. The first toe joint in this model, as you see it, is right here off of the first metatarsal head. A bunion is a swollen up or inflamed joint. Now you can have swollen up inflamed joints anywhere in your body. Large joints like your shoulders or hips, everybody knows about that. But also with the relatively small joints. Bunions are generally an inherited condition, but can be made worse by certain shoes and activities. Many people will find that in their family history, their mother or father, aunts or uncles, even a sibling, has a swollen up first toe joint. And the bunion itself is localized arthritis or a bursitis of that first metatarsal phalangeal joint. Often associated with it is a certain angulation of the first toe away from the midline. Bunions can be generally made to feel a little better by certain larger shoes, on occasion by orthotics or inner soles, anti-inflammatory pills such as Advil, as long as that doesn't upset your stomach, occasional use of ice. It makes sense that the more you're on your foot or the more activities you do sports related, that's going to hurt a bunion more than somebody that has a lifestyle or a job where they don't stand a lot. So the conservative treatment for bunions are bigger shoes, anti-inflammatories, and orthotics or inner soles. Bunions, when they continue to hurt even after this, can go on and need a surgical procedure to try and relieve the pain and realign the joint. All bunion surgeries are concerned with the angle between the first and second metatarsal. This is your first metatarsal, and if the bunion is off of here, and this is your second metatarsal, often these two bones are quite splayed, a large V. Besides removing the bump of the bunion surgically, we now have to think about how we're going to push this first bone closer to the second bone. We do that through a bone cut. A bone cut is called an osteotomy. An osteotomy, once it's moved over to try and reduce that angle, will cause, you'll have less chance for reoccurrence of the bunion if you address that. If you just remove the bump of bone, often the bunion can come back. Now when we remove a bunion and realign a bone, we'll hold it in place with anything from screws to plates to wires. Most often, most of us, myself included, use a screw to hold that in place. These screws don't have to be removed at a later date unless they become a problem, which is very rare because the newer screws are so low profile and so small that they do the job great, but you never know they're there. People always wonder, am I going to blow off the security cameras or the security checkpoints in the airlines? I've never seen that happen, but everybody asks that question. So a bunion takes about 4 to 6 weeks to heal up. You have to wear that funny little, it's called a cam walker, a little Velcro splint while you're healing up because you want that bone to heal in a new position. You might have to use crutches for a few days. Most people who have sit-down jobs, they can go back to work within a week or two. If you're a teacher, a policeman, a hospital worker, you might have to take as much as 3 or 4 weeks. And that's what I wanted to tell you about bunions today. Thank you.